Hi, everybody. My name is Stephen Perez. Today, I'll actually be talking about the different treatment prevention options for the polio virus. For the better part of the 20th century, doctors and scientists had been looking for and testing various ways to prevent polio, and it's only up until recently that polio has been eradicated thanks to the work that was completed by those people. The first thing that I'll be doing here is let me share something here with you. And of course, it won't let me. There we go. Okay. Awesome. So the first thing that I'd like to talk about here is literally the actual treatment of the virus. So let's be treating someone who has polio. So there's no cure for polio once it's been contracted. So the best way to treat someone with it is to make them feel comfortable until the visible symptoms have passed. First thing is bed rest. Next thing would be pain relievers, and then we have moderate exercise to offset loss of muscle and deformity, healthy and nutritious diet, and then last but not least, portable ventilators for breathing assistance. This is actually all called supportive treatment. That's really all that can be done as far as treating polio is concerned, which brings us to prevention. Next, I'll talk about how it can be prevented, how often it needs to be received, as well as the history of the prevention of polio. So it's done by vaccination in different stages. The inactivated poliovirus vaccine comes in 4 doses: 2 months old, then 4 months old, as far as how old the children are concerned, then between 6 and 8 months old, and then between 4 and 6 years old, right as the children are entering school. It's really interesting because after the second dose, the vaccine is actually 90% effective, and going to the third dose, 99% effective, and which is also really cool because we have the 4th dose, which makes us immune. The next thing after that is actually adult vaccination. It's not something that we have to deal with, mainly because we're already immune. And according to the Mayo Clinic in the US, adults aren't routinely vaccinated against polio because most are already immune. However, certain adults at high risk of polio who have had a primary vaccination series with either IPV or the oral polio vaccine, or OPV, should receive a booster shot of IPV. That booster shot lasts for life. If the adult needs vaccination because he or she wasn't vaccinated or the vaccination was undocumented, the vaccine is given in a series of shots. The first 2 doses of IPV are given at 4 to 8 weeks, or 4 to 8 week intervals. And then the third and final dose is given 6 to 12 months after the second dose. This brings us to the history of polio. In 1936, we have Maurice Brody. He attempted a formaldehyde-killed polio vaccine, which didn't cause immunity to polio. He originally tested the vaccine on himself and on his assistants, then to as many as 3,000 children. Many of those children developed allergies to the prototype vaccine. That brings us to 1948 with John Enders and his colleagues there at a hospital in Boston. From what he and his colleagues tested, one of his colleagues, Thomas H. Weller, put a polio-infected mouse brain tissue in a test tube. Polio cultures grew, which allowed the further research and development of the vaccine. In 1952 through 1955, we have Jonas Salk. he did nationwide testing of roughly 1.8 million children, which yielded a 60 to 70% effectiveness against polio virus type 1, and then 90% effectiveness against types 2 and 3, and then 94% effectiveness against bulbar polio, which takes us all the way to 1987 when we licensed and enhanced potency IPV, which became the polio vaccine of choice for the United States. Which after, looks like about 7 years, we have in 1994, it helped eliminate the polio virus from the Americas. From the 1990s and on, the polio vaccine has helped rid many countries of polio epidemics. Here's a list of just a few. In 2000, Australia, China, and 36 other countries were declared polio-free. In 2012, all of Europe declared polio-free. 2014 was India. In 2015, Nigeria. And then again in 2015, the World Health Organization reported that only 2 countries remain that have the polio epidemic, which are Afghanistan and Pakistan. I'll conclude by showing exactly how a vaccine works through the image on this final slide here. A vaccine is a dead or weakened form of the disease that is injected into the body. The body recognizes that antigens shouldn't be there, so the body makes antibodies to combat these antigens. So if a stronger form of the disease were to ever re-enter the body would be able to fend off the disease, which would be keeping you healthy. That's all of the PowerPoint there. I hope you enjoyed it. I hope you learned a lot. I certainly did. Thank you for watching and listening, and I hope you enjoyed the video.